It is time to check in with infectious disease specialist Dr. Zain Chagla with the latest developments of COVID-19. Good morning. Happy Friday.
Hi, good morning, Bob. Happy Friday.
Yeah, just before the break, we were mentioning at 10 this morning, Dr. David Williams is making an announcement about AstraZeneca. We'll be live streaming that, but it's expected he's going to say it is safe. Now, we have all these AstraZeneca doses that are set to expire May 31st. Now, I know there's some studies out there saying it's safe, but is this, because we have these expiring doses, and why aren't we donating them? Because we have so much Pfizer and Moderna coming in.
Yeah, I agree. I mean, I wish the plan would have been made well before this, right? So the unfortunate part is these doses are going to expire one way or another, and it's pretty hard to donate them at this point in time. It's a bit too late,
the timeline.
to get. Yeah, exactly,
tight.
right? It's too tight. But I think, again, a lot of Canadians are looking to getting their second doses, and this is a way to speed it up. Many people are 4 weeks past their first dose, which is appropriate. Pharmacies seem like they're able to do this appropriately, and so it's a good idea. At least let's use the doses we have rather than losing this, which would be a complete tragedy after everything.
Right. Yeah. Now, Health Canada says we're seeing a relative small number, but there's fully vaccinated people getting COVID-19, and 13 people died, 3 tragically in a long-term care home in Ottawa, fully vaccinated. I believe it was the South African variant, but can you put this in context for us?
Yeah, I mean, there are 13 people that have died of COVID-19 amongst, I believe, across Canada, something like 20 million doses that have gone, no, probably less, 15 million doses that have gone in. That's pretty good, right, relative to the numbers. Yes, the folks in long-term care passed away. It's tragic, but one has to remember people living in long-term care have many medical issues in the background. Even mild to moderate COVID-19 in those individuals might be, unfortunately, something that pushes them over the edge. But the fact is that hospitalizations amongst people who have gotten a single or 2 doses of vaccine are incredibly lowered. And, there's a nice study of the U.S. of a nursing home outbreak where, unfortunately, one person did die who was fully vaccinated, but there was still 95% protection against death and significant protection against getting COVID-19 in that nursing home for people that were fully vaccinated, right? So there are going to be the anomalies, there are going to be the cases that come through. Unfortunately, we're probably going to see as part of our lifetime people that are going to be hospitalized and die of COVID-19, like influenza and others. But it's going to be such a small number relative that it's not going to overwhelm healthcare, and it's going to really be something that we can manage long term.
Yeah. From there, the British right now, they're doing a study on booster shots, the efficacy of that, and perhaps a third dose, and also an annual shot. Do you think that's going to be required?
Yeah, I mean, I think we've had variants emerge. We know immunity over the next, 6 months is probably fine, but we don't know what a year looks like. It's probably good to get these in the chest and ready to go in that sense. Do we need them right now? Probably not. Would we need them in winter of next year, particularly in some of those vulnerable populations like long-term care populations where even a vaccine escape variant like the B1351 may show up? Yeah, probably. At least that's a population that might need to be targeted. So, I think boosters are on our table for a little bit of time, maybe not forever. And again, those vulnerable populations are probably the biggest targets of it, such that they're also prevented from getting significant serious illness on top of, the population being protected from COVID-19.
Okay. Let's talk reopening plans. We can finally golf again, which is great because I could never golf before. I'm a crappy golfer, but you've been on this forever about it was ridiculous that golf courses were closed. The risk of transmission was so low.
Yeah, I mean, it's good to see that they're following the science. The long weekend is coming. It's 20 degrees outside. I think people are looking to do the right thing, and the government is saying, okay, we're going to let you do the right thing in that sense. So, this makes sense. Unfortunately, as you said, it's not going to improve anyone's golf game that doesn't know how to golf as is. But, this is a good first step. And I think I like the reopening plan. They're using vaccines. They're using benchmarks. They're using the outdoors predominantly, which keeps it low risk, and giving a good chance for vaccines to get in and hospitals to decompress over the next month.
Yeah, so, and you think it's reasonable that we're going to hit these targets at these stages?
Yeah, I think so. I mean, we're doing 1+% a day, right? So in a month, that's 30% more of the population that's going to get a dose of vaccine. That's pretty impressive considering that's every month going forward. It's going to look like that.
Okay. Well, we'll talk again next week, but we appreciate your weekly visits and have a great long weekend. Dr.
You
Zain
too.
Chagla.
All the best.